Thank you, Professor Shortell, and I'll turn it over to the panel to ask each other questions and engage each other for about 15 minutes, and then we'll open it up for audience questions. So if you have questions, go ahead and write them down, and you can pass them to the aisles, and someone should start collecting those soon. So for now, to you.
Yeah, I'm going to start off and throw a softball right down the center of the plate to Helen, because it comes up so much. And that is the other thing. There's a lot of talk about these not-for-profit insurance cooperatives as an alternative to public option. And so, some thoughts on that.
Well, this is not a new idea. There has been nothing preventing anyone from starting a nonprofit cooperative for the last, I don't know, at least 40 or 50 years. There have been a number that have been very successful, but by and large, probably one of the biggest was Group Health Cooperative of Puget Sound, and it eventually had to merge with Kaiser, I believe, right?
It's not fully merged now, but it's a relation.
Fully merged. So, so they haven't had a really strong, we haven't had a strong track record of them, either at a statewide level or in terms of driving down the costs of other insurers in their area. So it's not clear what the real value of this is, and perhaps there might be incentives to start these, but I think many of us believe there's no real reason to think that they might have the same kind of effect as a public plan. I think it's fine if they want to put incentives to form these. I just don't think they're the solution to any problem. It's one of these solutions that's looking for a problem to solve, is how I would put it, I think, to my students. And so it's a fine idea, but I just don't think it really addresses the key problems that we're trying to solve in this debate. So I don't think it's going to go anywhere. I don't think anyone believes it's a substitute for a public option, and I think it's going to come and go pretty quickly.
So let me just follow up on that and sort of engage on the public option, just to throw a sort of little faster pitch. One of the main conservative critiques of the public option is that if there were such an option, the government might not be able to resist favoring the government option in terms of providing extra subsidies to this government plan that private insurers would not get. And that over time, what this could result in would be squeezing out the private insurance market. So the Kaisers of the world that have been so innovative and helping us learn how to deliver care better could get squeezed out. And we know that Medicare, for all the promise that Medicare could have for using its large population to do better, has often done pretty bad, actually. They're really bad at encouraging preventive care. They've been overpaying specialists. They've been creating all sorts of problems in the system, and that if we squeezed out this private sector through these subsidies, that it could cause long-term harm. So how do you respond to that?
Wow, there's a lot to respond to there. I wouldn't say that Medicare has been bad at providing preventive care. When the Medicare legislation was written in 1965 or 64 and was enacted in 65, there was Section 1862 which prohibited any payment for preventive care. This was written into the legislation by the Congress. So, and medical schools have traditionally done a terrible job in training physicians in preventive medicine. It's been a sort of a neglected specialty off to the side. Most physicians don't even get a course in nutrition, which we know is one of the major determinants of our health. So I wouldn't blame the Medicare program. I would blame the policy as it was written that prohibited those payments, and much of that has been addressed now. Starting in the 80s, Medicare began paying for the pneumococcal vaccine first. It now pays for the influenza vaccine. It pays for most screenings now for cancer for both women and for men. It still doesn't do a good job in some of the heart disease risk factors like hypertension and cholesterol. But if you look at all of the bills that are currently in committee, they all would expand benefits to cover all of the preventive services recommended by the U.S. Preventive Services Task Force, which are evidence-based recommendations based on the best science of what we know works and what works well in keeping people healthy or catching diseases early. Those recommendations would be adopted uniformly under Medicaid, under Medicare, and under private health insurance. So I think that regardless of what bill we get, we will be seeing massive improvements in preventive care. And the most interesting part of this, and President Obama talks about this a lot, is patients will not be required to pay a dime out of their pocket to get preventive care. We know that even $5 can make a big difference in whether or not people go to get a service. And so preventive care will have this very special exemption in order to try to encourage everyone to get what they need, where there'll be absolutely no patient cost sharing at all. So just to address that point, because I'm passionate about that.
Well, if I could just follow up for a second. I think to these sort of conservative critics, I'm not sure that that would actually convince them. It might actually make their point. It's taken decades for the government to sort of address this. And that hopefully we'll get a good bill in place now.
Well,
but as the technology evolves, as new things come along, private organizations are able to adapt. And when you literally need an act of Congress to cover preventive care, then there could be problems.
I would say that what we have learned is that one does not write benefits into legislation. And I think that's why in this case they're saying we are going to refer to this independent expert body based on their review of the scientific literature and update the benefit package periodically to reflect the best science. And I think that's the way to go. I think we've learned a lot of things about how we shouldn't proceed from the Medicare program. And hopefully, and my sense is that we have learned those lessons and we won't make some of those mistakes again.